So, welcome all of you to this webinar on health taxation that we are arranging from the Joint Action PreventNCD project. This is, as most of you probably know, the Joint Action project is a huge effort from the EU Commission, where the ambition is to join the forces from the competent or public health authorities in the European countries to avoid fragmentation in the work against NCDs, and also to push forward the work on NCD prevention. And the project was based on the two of the core documents at that time, the Health It Together document and the Beating Cancer Plan, were also pointed to this particular topic as one of the area to be developed. My name is Anton Elve, and I'm leading one of the work package on structural measures, health taxation and regulation, and we are the ones that are arranging this webinar. And I'm very happy to have this prominent guest speakers from Franco Sassi, who is subcontracted by the project. We have Michelle Cestini from OECD, and we have Oliver Gainpod from the Taxud, which will all of them bring their perspective. And the target group that for the webinar is the people who are in general interested in public health, public policy makers, and other people involved in NCD prevention. And I've given these guys 15 minutes to speak. I'm not sure if I can trust them that they will keep to the 15 minutes, but if there is time, there will be questions in the end. So you are free to put the Q&A questions, and I will also think about some questions that we can ask. So without any more talk from me, I will just give the floor to the first presenter, which is Franco Sassi from the Imperial College in London.
Thank you, Anton. I'll just share my presentation. Okay, I hope everyone can see that.
So, sorry,
yeah.
if you click on the presentation mode.
Yeah. It's easier said than done. Let me see. Okay, because the button is hidden. Okay, that should be visible to everyone now. Okay, good morning, everyone. So the purpose of this presentation is to provide an introduction to what health taxes are, and just clarify some common misunderstandings about health taxes. I'll try to do it very briefly, sticking to the allotted time. So let me start from just a historical overview of what health taxes have been over time. Clearly, taxes on products like tobacco, alcohol, salt have existed for a very long time. I mean, in the case of alcohol, we are talking about taxes that have existed for literally millennia. So it's very established, types of taxes. But of course, these taxes were originally introduced for reasons that have nothing to do with health. They were clearly revenue-raising instruments. They were designed to address externalities. The public health rationale is really very recent. So the idea is that we have been moving from the old concept of sin taxes, which, as I say, has very little to do with health and is very much related to the economic rationale for using these taxes, to the concept of health taxes. And what you see in this slide is the cover page of a book that we published a couple of years ago, jointly with the World Health Organization, that sets out, these comments, these concepts in detail, and examines, how health taxes can be implemented in a number of key areas of public health. So a common misconception in public health is that this quote, which is used very widely in presentations about health taxes, but not necessarily appropriately used. This is a quote by Adam Smith, the economist Adam Smith, who wrote in 1776 as part of his work on the wealth of nations that essentially sugar, rum, and tobacco are commodities that are perfect candidates for taxation. And this is often taken, as I say, in the public health community to be a demonstration that even economists have always thought that these products should be taxed. But in fact, Adam Smith knew nothing about health, and certainly didn't have health in mind when he wrote that sugar, rum and tobacco are ideal candidates for taxation. What he had in mind is the characteristics that typically make products candidates for taxation, and these are that the products are not necessities, that the demand for these products is not sensitive to price, and that these products generate negative externalities. I mean, these are three characteristics, from a tax theory perspective that make a particular product or set of products an ideal candidate for taxation. And externalities are especially important, and there are huge externalities in the case of the products that were mentioned by Adam Smith. The externalities linked with alcohol are probably the greatest. We all know how much damage alcohol consumption generates beyond the person that is actually consuming alcohol. Think of traffic accidents, think of violence, think of damage to children that are born from women who have consumed alcohol during pregnancy, and so on. So the externalities associated with alcohol are really huge. The externalities associated with smoking are also very well known. I mean, they're not as big as in alcohol, but passive smoking generates a very large amount of externalities. And a couple of years ago, in 2023, the Food and Agriculture Organization published a report that for the first time shed light on the externalities of the existing of current agri-food systems. And it reached the incredible conclusion that agri-food systems today are producing as much gross value added as externalities, external costs for our societies. And a large part of those external costs are actually due to the health consequences of eating unhealthy diets. So the externalities are very big, but are these externalities sufficient to make a rationale for health taxes? And the answer is no. Because what makes a tax a health tax is really the fact that the health tax or the tax is designed to improve health. So this is a different concept from addressing externalities, which, as I say, are part of the rationale for taxing a range of products, even before we knew that those products might have health impacts. So if you look, for instance, at the conclusions of the so-called Mirrlees review, which is essentially a review that was carried out in 2010-11 by an international commission. James Mirrlees, incidentally, who chaired this review, is a former Nobel Prize in economics, and the commission stated that this was charged with the task of developing a vision for fiscal systems in the current century, and essentially they reached the conclusion on consumption taxes that there are strong arguments for differentiated tax rates where the consumption of a particular good or service creates spillover costs or benefits, which is not just interpreted as externality, that they add actually that taxes can encourage people to avoid acting against their own self-interest. So essentially, they introduced the concept that externalities can also happen within individuals when individuals make choices in their consumption today that may affect their future health or well-being. So health is not mentioned specifically here, but it's mentioned that people may act against their self-interest, their future self-interest. So that is exactly what provides a rationale for health taxes, preventing people from making choices that will actually have a negative impacts on their future self in terms of detrimental consequences on their health. Of course, the assumption is that people make those choices in a way that is not entirely rational under the pressure of incentives and influences that come from the environment that override their preferences and their actual self-interest. Now, the question that everyone is asking is, do they work? I mean, do health taxes actually make a difference to health? And here again, the evidence is overwhelming. I mean, the not just the rationale, but also the evidence that the taxes that have been used have made a difference in terms of healthy consumption and eventually health outcomes. So the evidence on tobacco and alcohol taxes is just overwhelming. I mean, there have been so many systematic reviews and studies that have shown how effective they are. So I'm not even touching upon those. The areas that are less established, perhaps in the view of some people, are sugar-sweetened beverages and food, but even in those areas, there are at least 2 systematic reviews for each, food and sugar-sweetened beverages. There are policy guidelines that have been issued by the WHO on sugar-sweetened beverage taxes and food taxes and subsidies. All of this is publicly available. It's published. Everyone, can see what the evidence is, and it points very strongly towards a positive effect of taxes on the consumption of products that are generating health risk, both in, as I say, in the area of food and beverages, non-alcoholic beverages. And now 2 more questions that are very common. Are these taxes regressive? Do these taxes harm the economy? I mean, the short answer to both questions is no. The taxes on tobacco can be regressive if you just look at the distribution of tax burden. But if you consider the wider economic effects of these taxes on individuals and households, the overall economic effect is actually progressive, with greater benefits for low-income individuals and households than for high-income individuals and households. Taxes on food and sugar-sweetened beverages can be designed in ways that will avoid regressive impacts. So the regressive nature of taxes is not really an issue that is a concern for policymakers. Do they harm the economy? Again, the short answer is no. Of course, there will be winners and losers. There will be some companies and some sectors that might lose out, perhaps. But overall, the evidence is clear. The economy doesn't suffer. Employment is not reduced from the use of those taxes. Let me conclude by just going through the 4 main areas of taxation that the joint action will tackle. And just setting out what the current challenges are and where the scope for improvement is. So tobacco is probably the most established area of taxation. Most countries in the European Union apply relatively high taxes, although tobacco products remain widely affordable at the moment. There is definitely scope for improvement in tax design, particularly keeping taxes up to date with inflation through a duty escalator, for instance. But the biggest challenge in the area of tobacco tobacco products is really the new products, the electronic cigarettes or electronic nicotine delivering systems that clearly escape taxation in many countries and really need regulation and taxation. Alcohol is probably the area that deserves the biggest attention, because at the moment taxation in European countries is very inconsistent. Taxes are small. Many countries don't even recognize that there is a health rationale for taxing alcohol. And alcohol taxation is not aligned to the alcohol content of beverages. So there is a very large scope for improvement in terms of the way we're taxing alcohol in the European Union. Just to give you an idea of the inconsistencies that exist, I mean, this is an overview. It's not just European Union countries, it's all countries in the WHO Euro region. And as you can see, for individual countries, these are the tax rates that are applied to different types of beverages, beer, wine, and spirits. And even within countries, there is a very large degree of inconsistency between the levels of taxation that are applied to different beverages, let alone the inconsistency that exists, across countries in how these beverages are taxed. Now, sugar-sweetened beverages, I think we are at a turning point in this area, because these taxes are now widely used, but with different tax designs. The most effective taxes are the ones that have incentivized reformulation, but we're not really sure at this point whether the reformulation that has taken place, incentivized by the tax, is really worthwhile. Sugar-sweetened beverage taxes are, sugar-sweetened beverages are ultra-processed foods. They contain additives that are certainly not healthy in our diet. So they are products whose consumption should be disincentivized rather than just incentivizing reformulation that doesn't change the fundamental nature of those products. Food is the new area for health taxes. There are ways in which food can be taxed in alignment with health objectives without overburdening people with additional taxes. This is all set out in a policy brief that we launched with the WHO a couple of weeks ago, which the cover page of which is in this slide, which sets out a new approach for food taxation that is based on nutrient profile models and doesn't really increase the overall tax burden on consumers. So in summary, 4 points. There is a strong rationale for health taxes. There is very strong evidence on the effectiveness of taxes in changing the consumption. But taxes need to be appropriately designed to have a meaningful effect on health. And this is a very important point that needs to be understood because taxes are complex and they need to be designed in ways that are really conducive to a health improvement. And finally, taxes are always a part of a wider public health strategy. They need to be supported by other regulatory measures, and they cannot be expected to make a difference on their own. I stop there and happy, to take questions at the end.
Thank you very much, Franco. So for this very nice and clear presentation about health taxes. So we will continue with the program, but just encourage the listeners to put questions in the Q&A channel so we can take it in the end if there are time. So then I will give the floor to Michel Cecchini, who is the head of public unit at the OECD, and he will say a little bit about the health and economic dividends of health taxes. So the floor is yours.
Thank you very much, Arfin. Good morning, everyone. Let me try to share my screen and put online my presentation. Here it is, number one. And you probably see the way around, right?
Yes.
Is it better?
Perfect.
Perfect. So thanks again for the invitation. It's a real pleasure to be here and contribute to the discussion today. In the next few minutes, I'll provide an overview of some of the work that as OECD we have been doing to support member countries and European Union member states in implementing better policies for better lives, including taxation for health purposes. When we talk about taxation for products that are conducive of an healthy lifestyle, as Franco mentioned in his presentation, we talk about externalities, and we already pay taxes for these externalities across European Union member states. So, for example, some analysis we carried out in the last few years show that lifestyle related to overweight and alcohol use have an impact on the productivity, on the competitiveness of European Union member states, and have an impact on the GDP in the order of magnitude of 3.3% for overweight and almost 2% for alcohol use. And this translates into a hidden tax that everyone across European Union member states have to pay, whether they are overweight or not, whether they drink alcohol or not. And these taxes are substantial. We are talking about 220 euros per capita per year of taxes to close the gap for the externalities caused by overweight, and almost 170 euros per capita per year for the negative impact of harmful alcohol use. Therefore, as I said, we already pay taxes beyond the consumption of the products, but everyone in the EU pays taxes on this product. And the same will be for tobacco. There is also rationale for having higher taxation for this product. Building on what Franco said in his presentation, we are experiencing decrease, or better, increase in the affordability in numerous EU member states for products that have negative consequences for people's health and economy. Looking on the left, a few years ago, we looked at the increase in affordability of alcohol products across European Union member states, and in around 20 years, affordability across the Euro of alcohol products was of 50%, meaning that in 2018, alcohol products were 50% more affordable compared to 2000, and in certain countries such as Slovak Republic or Czech Republic, the affordability was between 2 and 3 times bigger compared to at the beginning of this millennium. Moving to the graph on the right, cigarette affordability also increased in around half of European Union member states over the last decades, and in another 28%, the level of affordability remained pretty much the same over the last 10 years. Only 1 in 5 countries put in place actions, meaning higher taxation for tobacco, that actually decreased the affordability of these products over the last 10 years. When it comes to the impact of taxation on behavior, we see that there is a three-pronged effect of the price increase. And here are some examples of recent work we are now doing to support Brazil, that is trying to do a substantial reform of its taxation for tobacco product. Price increase have an impact on population health and healthcare expenditure, because on the one side, they postpone or avoid the onset of the behavior. For example, a 10% increase in tobacco taxation leads a 2.5-year delay in smoking initiation. And we know that smoking initiation starts in a very specific window. And if we manage to postpone the expected age of onset of initiation to tobacco after age 25, it's very much unlikely that for the rest of the life of a person, this person will start smoking. The second component, and it's the one that is usually most known, there is a decline in the quantity consumed. A 10% increase in tobacco price leads to a decrease in the quantity of cigarette smoke that varies, according to the various characteristics, by around 3% to 7.5%, meaning that these products are inelastic, and therefore increasing revenues is bigger than the decrease in quantity consumed. Number 3, particularly if part of a broader policy package, the increase in price support behavior cessation. We see that, for example, a 10% increase in tobacco price leads to around 4% decrease in the number of smokers in the country. And clearly this then translates in better health outcomes, and down the line, higher productivity and lower healthcare expenditure. When compared to other policy options, prevention options that countries have in their toolbox to promote healthier lifestyle, we see that taxation and pricing policies more in general are among the most impactful action. This is an example that comes from a report on alcohol consumption that we released a few years ago, in which we compared the impact on population health expressed in DALYs, disability adjusted life years, in terms of decrease in health expenditure, in terms of productivity, in thousands of full-time workers equivalent, and then in terms of return on investment. And as you can see, quite consistently, among the various options, minimum unit pricing and taxation, which are the two options that are at the bottom of the list, show the longest bars, meaning that they have the best performance compared to the other. In particular, when it comes to return on investment, for example, we are talking about a return on investment that is more than 100 times bigger for taxation, almost 200 times bigger than 200% bigger compared to what invested, meaning that investing €1 US dollar, Norwegian crown or whatever in this type of policy, and when I'm talking about investing, it means fundamentally better enforcement of the policy, we can expect a return on investment of around 183 euros US dollar crowns invested. But also the impact on population health, as well as the decrease in healthcare expenditure, are very high. Moving from theory to practice, designing taxation policies, whether they are for alcohol, tobacco, any other product related to an healthy lifestyle that countries want to tax, the devil is into the details. And it's very important to design, to have a proper design of the taxation to have the maximum impact on population health. First of all, price increases must be substantial to meaningfully reduce product affordability and influence consumer behavior. Having small tax increase as lower impact than we expect, and price increase must be sufficiently big. Number two, large one-off tax hikes tend to be more effective than gradual increases over time in driving a sustained reduction in consumption and changing lifestyle. Number three, the implementation of taxes needs to be accompanied, has to go hand in hand with robust enforcement mechanisms that are essential to support these tax policies, and in particular to play a significant impact on illicit trade and to ensure compliance of the taxation. In terms of governance and the discussion that always very often takes place between Ministries of Health and Ministries of Finance, our experience in working together with countries is that in some cases there may be different priorities that may pose some challenges. Clearly, while Ministry of Health are focused on maximizing health outcomes, Ministry of Finance often prioritize fiscal revenue optimization. And our experience is that the design of taxation may promote, in some cases, not always, there are win-win situations, but either of the two objectives. This brings me also to the figures that you see on the right-hand side of my presentation. This is the typical discussion that takes place when the Ministry of Health discuss with treasuries on the need to implement higher level of taxation. And Ministry of Health always look at the positive side of the morbidity, and there is, in some cases, a response from the treasury that higher level of taxation may lead to, at a certain point, impact on revenue, creating a sort of tension zone between the objectives of the Ministry of Health and the Ministry of Finance. This is, in the vast majority of cases, not the case in practical terms for various reasons, and I list some in my slide. There is, of course, a potential for a decrease in number of consumers for the reason that I mentioned before, in terms of reduction in initiation, but also a number of people that halt or stop using that product. But in any case, any reduction in the number of consumers is expected also to lead in lower healthcare expenditure enhance productivity that result in either tax revenues from other sources, and in particular also any additional tax revenues that are driven by the increased consumption of alternative products. It's not that if people spend less on alcohol, tobacco, they keep this money in their pockets and this money is not used. For example, as part of our work on alcohol taxation, we carried out analysis and we came to the conclusion that money that are saved on alcohol consumption are spent on other discretionary non-essential items, in particular restaurant consumption, hotel and recreation and culture spending. Therefore, there are other ways in which any potential decrease in revenue for the taxation is in many cases more than the sum recovered from other types of revenues and savings. Having said that, taxation should be part of a broader policy package. It's a very powerful tool in the toolbox of government, but it's not the single policy that countries should implement. For example, in the case of alcohol, OECD has identified what we call the PPP approach, which has pricing policies as one of its 4 fundamental pillars, but this should go together: policy enforcement to limit alcohol-related injuries and violence, protecting children from alcohol promotion, and finally, primary care to help patients with harmful drinking patterns. And the implementation, the scaling up of this approach across OECD and beyond countries over the next 25 years would have a significant impact in terms of people's health. We could avoid 8.5 million cases of alcohol-related condition. We could have significant savings in terms of healthcare expenditure and increasing productivity for a return on investment, which is 16:1. I'm getting to the end of my presentation. Just to say that the work that OECD is carrying out on taxation clearly is continuing. In particular, in the region, we have support for scaling up tobacco taxation in Southeast European countries, in which we are supporting Albania, Bosnia and Herzegovina, Bulgaria, Croatia, Kosovo, Montenegro, North Macedonia, Romania, and Serbia in implementing improved taxation policies, in particular, more effective tobacco taxation. We bring together and help the discussion between Ministers of Finance and Treasury, Minister of Health and National Public Health Institution, and we are going to produce a regional report on tobacco taxation following what we have already done for Latin America, but we also produce workshop on tobacco taxation in these countries, and we also get engaged with technical work, bilateral technical work with these countries, including Ministers of Health, Minister of Finance, Tax and Custom Administration. So if you are part of any of this group of stakeholders, feel free to reach out because OECD can support with funding that comes from Bloomberg Philanthropies. Last slide is really to provide you with a link to our publication on the topic, making available what is in the pipeline. There is much more than taxation that is relevant for this joint action, and we are going to produce vast majority of cases with support from the European Union, and it is also my email. Thank you very much for your attention.
Thank you very much, Michel, both for the listing all the resources in the end, but also you pointed to the same point that Franco has, that health taxes have to be seen together with all the other measures that is targeting NCDs. I think we just continue to the next presentation, which is Oliver Gainford, who is working in the DG Taxud, and he will talk about the current agenda of the use of fiscal policies within the EU. So the floor is yours, Oliver.
Thank you very much. Thank you very much, Arnfinn, and thank you for inviting me today. And thanks to the previous speakers, Franco and Michel.
Oliver?
I'm working in the. Can you hear me?
Yes, but you have to switch on the display settings because we see.
Sorry.
Perfect.
Okay, here we go. Sorry about that. I didn't realize. And as you said, I work here in DG TaxUD in the European Commission. I think it's been covered already, but the risk factors in relation to the impact of tobacco, sugar-sweetened beverages, and high alcohol usage on non-communicable diseases. There's no academic consensus on the links between their uses, the tobacco use, and the overconsumption of high fat, sugar, and salt products, and indeed alcohol, and negative health outcomes. The impact of tobacco use, the consumption of sugar-sweetened beverages, and high alcohol use are risk factors in 17% of all deaths from non-communicable diseases in EU member states. And of course, these not only reduce life expectancy, but they diminish our quality of life and have significant societal and economic effects as well, in terms of worker productivity and GDP, and of course, healthcare costs. But what I suppose, working in DG TaxUD, I wanted to talk a little bit about the fiscal tools that are available to help challenge those negative effects. And I wanted to talk about excise duty and also mention VAT as well. Excise duty is it's quite a targeted duty. It's an indirect tax on the consumption of certain specified products. And in EU law, we have harmonized structures and rates for alcohol and alcoholic beverages, energy products, and electricity, and manufactured tobacco. Of course, it's possible for member states to impose non-harmonized national excise duties, and examples include taxes on coffee and indeed sugar-sweetened beverages, which I'll be coming back to. The structure of excise duties, and this is important in terms of how they can target specific products. They can be specific, so that's an amount that's imposed based on the quantity or volume of the taxed product, and that's particularly useful if you have a product that's harmful and you want to target that specifically. And ad valorem, and that's based on the value of the taxed product. And then, of course, they may be mixed, having both specific and ad valorem elements, and the rates that are applicable to cigarettes as an example of a mixed excise duty. And additionally, the tax may be structured in tiers so that the tax rate depends on, for instance, either the strength of beer, or is uniform, so that one rate applies to all of that category. For instance, in relation to cigarettes, again, there's a uniform rate based on the number of cigarettes, regardless of the quantity of tobacco in each cigarette. And then VAT, EU value added tax, is an indirect tax that's collected at each stage along the supply chain, and it's charged on the value added to the goods or services at each stage of production and distribution. And in the EU, it's up to each member state to set the number and level of its VAT rates and the categories of supplies to which each rate applies. Now, I wanted to turn, I suppose, obviously, as I said, there are harmonized rules in relation to the taxation of alcohol and tobacco in the EU, but there's one area of, I suppose, development in the member states of the Union, and that's relating to taxing sugar-sweetened beverages. And as Franco said, that's like a subset of the HFSS products that we've been discussing today. Of course, the WHO defines SSBs as all types of beverages containing free sugars, and those are sugars which are added to food by the manufacturer or the consumer, and sugar is also naturally present in honey, syrups, fruit juices, and fruit juice concentrates. And they include your typical soda, but also flavored water, energy drinks, and sports drinks, ready to drink tea and coffee, and flavored milk drinks. And they're recognized as a major contributor to excess sugar and energy intakes, especially in younger age groups in our diet. They're very high on free sugars, and they're a very narrow and distinct category with low to no nutritional value. But being a narrow, distinct category, there's something that can be targeted by a tax. And of course, there's strong evidence that the SSB taxes increase prices, reduce sales, and stimulate product reformulation. And I suppose we can see that there are other taxes on products that are high in fat, sugar, and salt have been introduced worldwide, but SSB taxes specifically are quite broad throughout the world. At the moment, I suppose at the moment, there's a commitment in Europe's Beating Cancer Plan under the pillar on sustainable cancer prevention that it would investigate the feasibility of proposing new tax measures on sugars and on soft drinks. The farm to fork strategy provides that tax and incentives should also drive the transition to sustainable food systems and encourage consumers to choose sustainable and healthy diets. But of course, member states at the moment address the design of SSB taxation on sugar sweetened beverages individually. So there's a heterogeneity of approaches to taxes within the EU at the moment in relation to sugar sweetened beverages. And so what does that look like at the moment? Sugar sweetened beverages are taxed in 13 member states and Catalonia within Spain. Member states that tax other HFS products like ice cream, chocolate, and sugary confectionery is Denmark, and in Hungary, products containing sugar, salt, and caffeine, and products containing fats, saturated and trans fats, are also subject to taxation. So specific volume-based excise duties on sugar-sweetened beverages are the most common form of HFSS tax structure across the member states at the moment. And you can see, as I was discussing excise and VAT, of the 27 member states, 13 tax sugar sweetened beverages, and of those 12 use excise to do so, and one, that Spain, use VAT. And of the 12 member states who apply an excise tax to sugar sweetened beverages, 11 use a tiered structure, and while the Netherlands, use a uniform rate. And as I was saying, the use of a tiered structure allows you to target the proportion of the ingredient that you want to target in a particular product. And then the scope of sugar sweetened beverage taxation within the EU. The main exemptions are for milk and milk-based drinks, and sweetened and unsweetened fruit and bottled water. So of the 12 member states who apply an excise tax to sugar sweetened beverages, 9 exempt unsweetened juice, 3 exempt sweetened juice, and 9 exempt milk or milk-based drinks, and all but 2 exempt bottled water. So bottled water, that's taxed in the Netherlands and Finland. And so then, observing the tax choices made by member states, we can identify the following key design features. The level of government levying the tax is normally at the central government level, except for the region of Catalonia within Spain. The types of taxes, they tend to be specific or ad valorem. The scope of the taxable products. As I was saying, there tend to be exemptions for milk-based drinks and sometimes for juice-based drinks as well. The tax base and the tax structure and the point of taxation and the potential exemptions, and those are the kind of choices that are open to member states when they're designing their taxes. And then health taxes from an EU perspective, and I wanted to talk a little bit about a study commissioned, an external study commissioned by the Commission in relation to health taxes within the EU. So it looked at it was a foundation for discussions with member states, and it looked at a detailed analysis of selected health taxes at national level, looking at their design. And it was an examination of the rationale and design used, and also an examination of a possible EU health tax, looking at the need and problems and potential objectives and coherence with the wider EU priorities. So they looked at the observed supply side effects of HFS taxes. Typically, they were high cost pass-through rates, and so it's meaning that the taxes got passed through to consumers, although sometimes there was a time lag for the cost pass-through. The extent of product reformulation varied considerably depending on the brand and the member state concerned. It also depended on the use of tiers. Use of tiers seemed to be quite more effective in driving reformulation. The progressive tiered tax systems were more effective, and voluntary sugar reduction programs were seeming to have a less of an impact. And then, of course, at the demand side, the observed effects were that the demand for HFSS products was relatively inelastic. However, there are many other variables at play, and the introduction of a low tax rate will likely have less impact, and consumers were inclined towards product substitution following introduction of HFS taxes. And that once moving away from the targeted product, their changes tended to be lasting and structural and lasting in nature. Both the benefits and costs of HFS taxes tend to be higher for low-income groups, and that drives changes in consumption patterns, of course. And the role of HFS taxes in cross-border shopping was difficult to establish due to a range of existing differences in terms of pricing structures between different markets. Positive health impacts are observable with changes in healthcare costs associated with a reduction in body mass index. However, the evidence is not always at the moment robust, and it mainly comes from simulation studies. So to talk about the key observations then from our examination of health taxes in the EU member states. Behavioural taxes can play a significant role in the policy mix to promote more sustainable choices by both consumers and industry, because there's both a demand side and a supply side response to the introduction of HFSS taxes. Well-designed SSB excise taxes can lead to price increases which suppress consumer demand and stimulate product reformulation, and a thoughtful design with an appropriate number of tiers and threshold levels shape how industry reformulates, and the health benefits and changes in healthcare costs are associated with a reduction in the body mass index, and beneficial health effects are expected to be stronger for the lower income households or in most member states, and taxation should not be viewed in isolation, but as other speakers have said, be part of a broader political agenda, especially in the field of health. And thank you very much for listening to me.
Thank you very much, Oliver, and to the rest of you. I think that these have been very clear and nice presentations, and I think that we have had a couple of questions in the Q&A, but before I will ask a question to all of you, I just wonder if you have any comments to each other, if you want to comment upon, if Franco want to say something to Michelle or Oliver, or are you...
I have a quick comment or question for Oliver. Actually, in his presentation, Oliver has talked often about HFSS, which is normally a definition, a label that is applied to food. But of course, the focus was on sugar, sweet, and beverage taxes. But does that mean that taxes is potentially considering a wider definition of HFSS to extend that can be extended from beverages to solid foods at the moment?
I'm not proposing a redefinition of HFSS, no, and I suppose it's used in different contexts, but certainly, I suppose, sugar sweetened beverages, they're low in any dietary input, and they're very high in sugar, and they're consumed. So I'd see them as part of the HFSS area.
Thank you. So before I go into the questions from the audience, there was one thing that I was wondering about, because I think Michelle showed that there were tax differences between the countries, and I just wonder if you can reflect a little bit about the challenges with the cross-border trade, the challenges with illicit trade, and that it's not only about taxes within the country, and if they have these huge differences, it might be a challenge also for introducing new taxes. I wonder if you would like to reflect a bit on that. Any of you? Michelle?
I'll start, and I'm happy also to hear the view of the others. Clearly, this is often perceived as an issue. I mean, there are two different issues. One is cross-country differences, particularly for countries that are relatively small in size and believe that there is a lot of potential revenues that are missed because people go across the border and buy. The second issue is, instead of illicit market and decreasing revenues due to the fact that people are moved to the illicit market. Clearly, harmonizing taxation in the bloc, I think it's the way forward as much as possible, particularly for unhealthy products. But the impact of cross-border taxation tends probably to be much smaller than what certain actors in the discussion of taxation think. Second issue on illicit market. Illicit market, we need to take into account that the industry behind the illicit market is similar to the normal industry in terms of behavior, in the sense that they want to maximize the income, the revenues, as much as possible. We see from our work, particularly in Latin America, that when there is a tax increase, the illicit market also follow this tax increase, this increase in price of the product, fundamentally to move up because it ensures higher revenues. Second, there are also problems related to logistics. It's not that for the illicit industry is super easy to bring in new additional product compared to the levels that they already have. Therefore, again, very often this is pointed to as an insurmountable problem. Enforcement is important, is one of the points I made, but there are ways to limit any negative impact on this. Over.
Thank you. Franco and Oliver, do you want to comment on this, or should I take a question from you?
No, I think Michele's answer is very comprehensive, so I don't have anything to add.
Okay, but then I will just ask some of the questions from the chat, and I will, to honor the first person who asked the question, I will just read her question, which is, when implementing health taxes, how do you prevent the industry overshifting the taxes, leading to maintain profit for the industry, but public outrage going towards government rather than towards the product itself?
I have provided a written answer in the Q&A, but effectively, as I said, I mean, usually the concern is about undershifting of these taxes, not so much overshifting. Overshifting is relatively rare. I mean, of course, the companies that can manipulate prices following a tax increase or the application of a tax are those that have multiple products, that have a large portfolio of products and can allocate taxes to different types of products without necessarily following the targeting of that particular tax. This can be a problem, but I think the instances in which governments have been successful in preventing an undershift or overshift. There have been instances in which governments have been monitoring in a transparent way price trends by different retailers, and that has been usually an effective way of making sure that retailers and manufacturers actually pass on the tax in the appropriate way.
Thank you. Another question here is it's more about combining taxes on sugar sweetened beverages and subsidizing healthier products. So the question is, why is it so hard to implement taxation on sugar sweetened beverage and use the money to reduce pricing on vegetables? Does anyone of you have any reflection on that?
It's not difficult. It's just the governments are not willing to do it. Perhaps I mean, any form of earmarking is of course problematic. I mean, but this comment is not suggesting earmarking. Presumably, I mean, it's suggesting reduction in tax rates on healthy foods. That can be funded by a tax on less healthy foods or beverages in this case, which is very much in line with the spirit of the taxation approach that we have proposed in the WHO policy brief that I mentioned in my presentation. The point is that you can't just identify a very narrow range of products that you're going to tax and a very narrow range of products that you're going to subsidize or for which taxes are being reduced. I mean, you really need to apply this approach consistently, across the entire food supply or diet, because otherwise you're always going to have substitutions that will offset the benefits of the taxation system. So what we have proposed in that policy brief is really the use of a nutrient profile model. For instance, as Oliver was mentioning, a nutrient profile model that identifies HFSS foods and classify foods on the basis of their content of key nutrients, and then you apply that across the board to all foods, and you establish tax rates that are consistent with that nutrient profile model.
Great. So now we'll just jump to another question here. It's regarding the question on taxation of sugar versus sugar substitutes, that they are different in their effects, aren't they? And therefore, why tax sugar and sugar substitutes to the same degree? I don't know if this is the case, or is sugar substitutes also taxed? I don't know. Anyone want to respond?
I'm happy to respond again. The sugar substitutes are taxed in a number of countries, not in all countries. I mean, some countries only tax beverages that are sweetened with sugar. There is a strong case for doing that, of course, and that is partly what I discussed in my presentation. The sugar-sweetened beverages and beverages sweetened with non-caloric sweeteners are all, ultra-processed foods. And ideally, countries may want to reduce the consumption of all these beverages across the board. So that is the rationale for the taxes that apply to both sugar-sweetened and artificially sweetened beverages. When the countries that have been trying to incentivize reformulation have applied those taxes, there were no guidelines officially on the use of artificial sweeteners. Now we do have those guidelines. The WHO has produced a couple of years ago a set of guidelines on the use of non-caloric sweeteners in beverages, and the evidence seems to point in the direction of essentially the same level of health damage from artificial sweeteners as we get from sugar in the long term. I mean, clearly for some consumers it may be beneficial, as a way to reduce sugar. There may be benefits in terms of reduction of caries, but in terms of dental health, but generally there's no benefit in the long term from the replacement of sugar with artificial sweeteners.
Thank you. Okay, I think we stopped there. We have had 3 great presentations, and thank you to Franco, Michelle, and Oliver, and thanks to the audience who were here, and thanks to all the questions in the chat that I have not asked because they're a little long. But I think that I just wanted to say in the end that this webinar is recorded and it will be available on on the project website for other people, or if you want to have a look at it afterwards. So again, I thank you all for showing up, and particular thanks to the presenter, and have a nice day and a nice weekend and so on. Thank you.
Thank you.
Thank you. Goodbye.